Hi, sir. How are you? Can you give me a smile? Give me a smile. And we can see he has nasolabial fold flattening on the right side. He also has trouble with excursion of the smile on the right side. And I'm going to help you lift your arms for me. Keep them up. Keep them up. Okay. He's having rapid weakness in this side. Keep them up as hard as you can. Try. Ready? And he has rapid fall to the bed with the right side. And we can see again the subtle movements of the leg, which is externally deviated, and that's a subtle sign of weakness on this side. I'm going to help you move your leg. I want you to keep it up for 5 if you can. Here we go. Keep it up for 5. Okay, falls rapidly, and here if you can keep it up for 5. 4, 3, 2, 1. Very good. Thank you. Can you tell me what this is called? What is this called? What is this called? So aphasia can range in a continuum from complete mutism, so a patient can't talk at all, to a patient having errors, and we call paraphasic errors. So they may call a watch something similar to it that measures quantity, like a ruler, or they may make paraphasic errors that are called semantic paraphasic errors, and they may say talk instead of clock, or swatch instead of watch, something that rhymes with it, but they're unable to clearly express themselves. Patients can also have receptive problems with language, so he may not understand my commands, but for this patient we see that he understands the commands, he tries to do them, but his problem is an expressive part of language which he cannot output. So that's the left MC syndrome. Okay, now we're going to demonstrate one of the important signs of right MCA syndrome. In addition to having weakness on the left side of the body, face, arm, and leg, and sensory deficits on the left side of the body, patients may also have something called neglect. That's a really important cortical sign. So close your eyes for me, sir, please. So I'm going to demonstrate that. Let me know which side I'm touching.
Right.
What about now?
Left.
Okay, very good. And now, what about now?
Right.
Okay, where am I touching?
Right.
Where am I touching?
Left.
How about now?
Right.
Okay, so as you see, when we examine the patient, he can feel sensation, albeit less sensation on the left side of the body. When we touch both sides at the same time, they exhibit neglect. And that is a sign that involves a large part of the brain, a cortex of the brain on the right side. Also, he's not gazing at me, so he's looking away from the side of weakness. Sir, look over here. Follow my thumb with your eyes. Look over here. And he has trouble crossing the midline. We can already notice that he has external rotation or external deviation of the lower extremity, and that's a subtle sign of weakness. I'm going to help you lift your leg up. If you have drift in the limb, can you keep your leg up? And it can drift down to the bed. That's also, although the leg is not included in LAMS, that motor function, patients with anterior cerebral strokes, for example, may have leg weakness but not arm. So now we're going to demonstrate cerebellar syndromes. Cerebellar syndromes are really important because they may fluctuate, and the patient may have very severe deficits and may even be unconscious and wake up from consciousness with some deficits. Hi, good morning. So tell me what's going on. What happened to you today?
So I woke up and I felt really dizzy. I felt like the room was spinning. I've been very nauseous. I've been having some numbness to my face and my arm a little bit. And I just feel like I just can't walk right.
Can you touch your finger to your nose? And I want you to try and touch my finger. So go back and forth as fast as you can. And you can see that she doesn't follow a normal path, and she's having some ataxia. And so on this normal side though, can you show us how you can touch your finger and then touch my nose and go back and forth as fast as you can? Good. I'm going to move it and then you follow me. So you can see that she has trouble making a clear path to my finger, and then also she will pass point and not be able to meet my finger. Okay, you can relax. Can you show us how you can trace with the back of your heel your shin? Try to do on the top of your hip. Very good. What about the other side? So this is the abnormal side. You're going to find ataxia in the arm where they can not go the straight path, and also with the leg. Show me your normal side. Use your heel and trace your shin, please. Very good. And then that's a normal smooth movement. So we've demonstrated today some of the cerebellar signs.